joining us today for Equality Florida's very first Equality Florida HIV Town Hall meeting. If you're logging on and joining us, we're going to hold for just a few minutes while folks log on to join with us. We have an exciting panel today of experts and leaders in both the LGBTQ space here in Florida, but also in the area of education and advocacy for people living with HIV here in Florida. So if you're joining now, please hang out with us for a minute and we will get started in just a few minutes. For those who are joining, as we get started with Equality Florida's very first HIV town hall meeting in response to the COVID crisis, I want to remind folks as you're joining that you can visit Equality Florida's website to get up-to-date information, a brand new resource guide that's just been produced related to the COVID-19 moment at equalityflorida.org or eqfl.org to access that COVID-19 resource guide. It will also be referenced a few times in our conversation today with our panelists. And I also want to remind folks that are joining as you join that if you are listening to the conversation and you're inspired by it or have a question that you'd like our panelists to ask, if you're one of our experts in the HIV space who have joined to also provide support to this dialogue, just throw a comment in the comment section of the Facebook Live. We'll be able to see it, and we will, as we move through this conversation, be surveying the comments and saying hello and looking for how we can best guide the conversation towards the needs that you have. So I think we should go ahead and get started. Let me introduce myself. I'm Joe Saunders. I am the Senior Political Director for Equality Florida, a former state lawmaker from the Orlando area, now relocated to sunny South Beach. I'm excited to moderate this conversation for us today. And we're joined by two members of the Equality Florida staff team who combined have decades of experience in organizing and advocacy for our LGBTQ community and for people living with HIV. I want to begin the conversation today by throwing it to them to do some brief introductions, and we'll get started. First, I want to pass the microphone to Equality Florida's HIV Advocacy Coordinator and leader of the Equality Florida HIV Advocacy Project, Alejandro Acosta.
Hi everyone, my name is Alejandro Acosta and I am the Equality Florida's HIV Advocacy Coordinator. I have been actually living with HIV for about 17 years. I have been working in the space of education and sharing sexual health tips for the last 8 years. I have been working with Equality Florida for 3 years. I do want to make a disclaimer. I am not a medical professional, right? I will base most of my answers on my experience and the things that I've read and what I've read, heard throughout the advocacy work. Thank you.
All right, and also we have with us as part of our panel a founder of Equality Florida, a co-founder, and our deputy director, second in command, an expert on many, many, many things, Stratton Politzer. Stratton, you want to come introduce yourself?
Thanks. Welcome to our, as Joe said, our first Facebook Live town hall dealing with issues surrounding COVID. For me, one of the reasons I wanted to be a part of this panel is as the spouse of someone who's been living with HIV for about 20 years, and that I'm going to be sharing some personal experiences about things we're running into that I bet are questions other folks are having right now out there in the world. I also want to mention that we know we've got a number of experts listening in as part of our live audience on this call. I know we've got Michael Ruppel and some other folks from the AIDS Institute. And just as a disclaimer, I don't have a medical background. This is not a team of medical experts, and we welcome comments in the chat as we're going through. If you want to add some additional information, detail, updates you have on policies that are breaking right now, please drop those in the chat. We'll try to lift those up. If you have, we may even direct some questions back to the chat if we get questions that are too tough for us. So we want this to be a collaborative process. So thank you, experts.
Absolutely, and I see that Michael Ruppel has joined us. Thank you, Michael, for being here. We expect we'll lean on you. Hey, Sean McIntosh, thanks for joining, and shout out to John Harris Maurer, our Public Policy Director, Equality Florida's Public Policy Director based in Tallahassee, who's on the thread as well. and has elevated the Equality Florida COVID-19 Resource Guide. Thanks, John Harris. If you're joining us, please let us know you're here. Just give us a shout out. We can see your comments as you make them. It's helpful for us to know who's participating in the conversation. We want this to be a dialogue, even as we engage with our expert panelists. Hey, Donna, glad you're able to be here with us. So Stratton and Alejandro, let's just get into it. I know that, as Equality Florida's, as Florida's largest LGBT advocacy and civil rights organization, when moments like this hit, when moments of emergency and crisis hit, we become kind of a first stop for all kinds of people who are reaching out for information and for guidance and to share their anxiety. And one theme that I know has come up quite a bit for us is this central question. We hear a lot in the press that there are unique risks for people living with HIV right now in the midst of the COVID-19 epidemic. So let's start there. Are there unique risks for people living with HIV right now? Alejandro, you want to kick us off?
Yes, there are, right? Especially if the person who's living with HIV is having problems with their immune system, right? So that's what we call immunocompromised. Otherwise, if someone is on treatment and someone is undetectable, we are not considered people that are higher risk of contracting or that the disease will in any way, shape, or form progress in a different way. Right now, there's no evidence of that. The idea that people who are immunocompromised, regardless also of their HIV status, because there's many underlying conditions that can add to that. So the idea of immunocompromisation is much more complicated than just an HIV status, right? So that's kind of like the basic idea and difference between, a lot of people have actually asked me, are you worried about your HIV? And to be 100% honest, I'm more for me personally, right? I'm much more worried about my smoking than I am about my HIV status. I am undetectable. I've been on treatment for the last 9 years, and my health is really in top shape, except for the smoking. And I really do recommend to stop now. I'm trying.
Yeah, Joe, I'll jump in. I want to co-endorse what Alejandro said. HIV status alone is not in any way an indicator of your vulnerability to coronavirus. What we know from the data so far is that people living with HIV, that for them, the virus follows the same progression that it follows in the general population. That said, if you are not in treatment, if you are immunocompromised, then you may experience more severe symptoms, including death. We need to say the hard truth. So if you're not in treatment, this is the moment to do it. And if you're experiencing barriers to getting treatment, we want to help break those doors down. This should be a great opportunity for everybody who's not in treatment to do so. And we want to help you do that. I want to say one more thing here at the beginning too about this part, which is even if you are in treatment and you are not immunocompromised and you, from a medical standpoint, have no risk factors that the general population wouldn't have, this is the situation for my husband. But one of the things you have to also think about that's just real is that there is stigma still in this world when it comes to people living with HIV. We fight against that every day. We spend a lot of time trying to eliminate the stigma of people living with HIV, but it's not gone. And while we don't know that this is going to happen, a concern we have that we're keeping an eye on is that at a time where we're hearing the really frightening stories of the possibility of medical rationing, we are fearful of what may happen when people living with HIV go into hospital systems that are overwhelmed. And so it's just one more reason as someone living with HIV to be extra careful right now, because that stigma exists out there. And we don't want to frighten people. We want you to know we are doing everything we can to make certain that decisions about medical rationing have nothing to do with HIV status, as they should not. And the National Institute of Health has made this clear. Assumptions should not be made about who is immunocompromised, including individuals with HIV/AIDS, without an individualized review of each patient. We're working on making sure that information is elevated to hospital systems, and we're even trying to design a document that people living with HIV can keep with them at all times, just in case you wind up in a situation where you need to make very clear to medical providers that stigma should not be directing their decisions in any way.
I just want to add to that in this moment, hospital visits are not an option. So when someone is hospitalized, they will be alone, and that might be you. So if that is you, you have to be very aware of your status and of the fact that you are not immunocompromised if you're undetectable, and that they should not be making decisions of your healthcare based solely on your HIV status. It has to be a review of your medical conditions, and yes, like Stratton says, this might get overwhelming. So you really want to make sure that is not happening, and if it does happen, that you contact us, right? That you send that somehow. We have technology, right? And you might not be able to see anybody, but you might be able to have your phone. And so make sure that either your family members or yourself sends us an email and, hey, just give us a shout out so that we know where to address our energies.
So first, let me just pause and welcome some guests. I see that North Miami Commissioner Scott Galvin, who's also the Executive Director of Safe School South Florida, has joined us. Welcome, Scott. It's exciting to see you here. Welcome, Bob Karp from Gainesville. Lovely to see you too. We've got some high caliber leaders from the LGBT community joining us for this chat. And as a reminder, if you've jumped in, this is Joe Saunders, Senior Political Director for Equality Florida, and the Deputy Director, joined by a panelist of experts, including Equality Florida's Deputy Director, Stratton Pollitzer, and Equality Florida's HIV Program Coordinator, Alejandro Acosta. Thanks for joining us for this conversation. If, as we're moving through it, you have questions or you enjoy what you're hearing and want to give us a shout out, please do that. We love it. We want this to be a conversation with our community, and please elevate up questions that may be of importance or impact for you and the folks that you work with. So guys, you both touched on this, but I think it makes sense to drill into it a little bit more deeply. Right now, if you turn on the news, from Donald Trump, from the president, all the way down to the local news, we're hearing about the risks and threats that COVID creates for people who are immunocompromised. I feel like that's the phrase that is being elevated the most often. And sometimes we do hear this short change of people, like as you rattle off the list of who may or may not be immunocompromised, you hear people immediately go to this, to a place of people living with HIV. So can we flesh that out a little bit? What does it mean to be immunocompromised, and how does that intersect, more specifically, maybe even if it is just to repeat it again, how does that intersect with the lives of people living with HIV?
Well, I want to jump on that one, right? The CDC and the reports have identified that underlying medical conditions like hypertension, diabetes, cancer, and people who have had respiratory problems are at higher risk of developing severe symptoms, including death from COVID-19. So those are the people right now that are being identified as immunocompromised. I do want to make a statement, right, that a lot of people, we might not know what other underlying conditions we have, right? Not everybody is on top of their health all the time. And so someone might have not gone to the doctor in a year or 2 years. We do have in the LGBTQ community a number of people who are either uninsured or underinsured. So you have a lot of people who are not able to seek medical treatment or at least diagnostics. And so they might be unaware of what medical conditions they actually have. When we see cases of someone very young, right, maybe succumbing to the virus, we might be completely unaware what underlying conditions that person might have had that they were unaware of. So everybody has to be vigilant and extra careful in these times.
Joe, I just want to lift up a comment from Donna Sabatino. Thank you for this. Donna reminds us that it's very important for people living with HIV to have your pneumococcal vaccine up to date. Thank you for that. That's also a reminder to the experts on the call. I know one of the things we're trying to stay on top of are late-breaking policy shifts from the state government here in Florida and how those impact people living with HIV. If folks want to start dropping those into the chat, we'll lift them up. If you are a policy expert, I'm talking to you, Michael Ruppel with the AIDS Institute, and you, Michael Rayner. If you've got information, please drop it in the chat. We'll lift that up.
Absolutely. Well, let's head down a different direction. So I mentioned earlier, and again, if you're joining us live, this is Joe Saunders, Senior Political Director for Equality Florida, joined by Stratton Pollitzer and Alejandro Acosta, two members of our team who have a deep and rich history and expertise in advocacy and education around issues related to people living with HIV. I think one of the questions that we've been fielding quite a bit, y'all, is questions related to medications and treatment. It's a complicated web of doctor's visits and medicines that people living with HIV move through. The questions around PrEP have come up quite a bit. And I think where people begin sort of broadly in their consciousness around this space is this belief that the clinical response to HIV has led to treatment regimens that can prevent acquisition of it can sort of manage a virus, right? So some questions we've gotten is if you're on a treatment regimen for HIV, does that put you at less risk of transmission or of acquisition of COVID-19? And the same question has come up around PrEP. Does being on PrEP as a preventative measure for acquiring HIV in any way protect you from COVID-19? So who wants to tackle that?
I'll go for it. I want to say also a hi to Felix from Dallas, one of our very good friends. One of the things that I have asked, have gotten asked a lot is if my HIV medication will protect me somehow from acquiring or make it less severe for COVID-19, and the answer is no. Right at this point, there is no evidence that any HIV medication, including PrEP, that which also is used for HIV treatment, will protect you from acquiring COVID-19 or will make or will serve as therapeutics. Right now, there is no 100% certain therapeutics. There's no 100% certainty that any HIV medication can help alleviate the symptoms. Now, there are medicines that are being investigated, and that is important because once that data comes out, people will be able to make more, better decisions regarding their treatment. If someone is on treatment, they should not stop their treatment. And if someone is not on treatment, they should not just start taking pills that they find or that they think that might protect them from virus. No.
Strat, let me throw a question at you. So, and it kind of syncs back to a point that you made earlier, which is this, as we look at higher risk communities, we can see that people who are not in treatment regimens, depending, right, this is a complicated area to discuss, but that folks who are not in treatment, this is a moment to really consider being in treatment. And so I know that you and I have worked together to help convene a coalition of LGBTQ leaders in Florida, inclusive of our HIV service providers, to just get a lay of the land in this COVID environment. Who's still providing services? How are services being restricted because of COVID-19? So there's kind of a series of questions that I know we riffed on talking about here, but the first starts with, are there any barriers right now to getting treatment and continuing treatment if you are part of programs? And second, if you lose your health insurance right now, how do you get into treatment? What is the way to do that?
Ooh. Alejandro, I prefer to. I'm going to pass out these questions to you if you feel like you can take first stab. Yeah.
Well, one of the concerns about people is maintaining their regimen of medication, and so there's a lot of people right now. We just heard today that 6 million people just applied for unemployment. So those people might also be now uninsured, and so you have a large amount of people who might be living with HIV who just lost their health insurance. And so there is a federal program called the Ryan White program, which is now and continues to service people who are living with HIV for basic HIV care and medication. The health department continues, the Florida Health Department or Department of Health continues to offer this service. Now, I would recommend to anybody who is uninsured or who just lost their insurance that there's a process, and they're changing how the process works. They're making it easier for people to apply online. They're also waiving some of the requirements for applying. So I would really suggest that people go to the website. Well, they can go to our website and see that we do have a link to the Ryan White program. And the Ryan White program will give them the regional offices or the different offices throughout their area, which could be also a nonprofit organization offering services of case management and of linkage to those services. And so it is very important that, again, people maintain their treatment in check. So if for any reason you've lost your insurance, go to the Ryan White program. It is important to also note that right now we just had a supplemental appropriations committee that approved $90 million to go to the Ryan White program, and $65 million to go to the ADAP program, which is the assistance of a drug, AIDS assistance, ADAP. AIDS
Drug Assistance Program.
Yeah, there you go. Can be a tongue
AIDS Drug Assistance Program. So let me pull this up just a little bit, just for folks who may be tuning in who may not be familiar with some of those names and acronyms. So pre-COVID, and for some time, the Ryan White program is a federal program that's offered to people who discover that they're living with HIV and need access to treatment. And for most people, it is 100% covered, and there's this complicated interplay between whether or not you have insurance and you don't. And so a very real reality that we're seeing right now is folks who are in that, the numbers just a few days ago were almost 3 million Americans who have lost their job as a response to COVID and may have lost their health insurance. So just to distill what Alejandro's point just was, is right now we believe, and through research that we've done, believe that this system is working, that people who do not have access to health insurance and need to stay in treatment, and people who've recently discovered they're living with HIV and want to access treatment for the first time can, through a local HIV service provider, sign up for the Ryan White CARE Act program. And so for those of you who are participating, who are somewhat familiar with the space, these are groups like Hope and Help of Central Florida, Care Resource, which is all over the state, Jasmine up in Jacksonville, a lot of the organizations that link up with our LGBTQ community and infrastructure. Their doors are open. They've made that very clear to us. There may be adaptations around things like whether or not you're going to do it via telemedicine. Like they may be adapting, but they haven't closed. And that's a really important thing for folks to know. And the best way to know which agency to direct people towards would be to go to here's the plug, Equality Florida COVID-19 resource guide, available on our home screen at eqfl.org.
We do have providers that we compile a list of providers around Florida. And if you're a provider and you don't see yourself listed there, just send us an email and we'll include you. It is, again, organizations like Latino Salud, like Pride Lines. There's a lot of partner organizations that are continuing to offer services, even though they might have some special instructions. So we always recommend that if you have access to Facebook, which you should, right, because you're watching a Facebook Live, a lot of these organizations also have Facebook pages that you can visit and see updated information there. So even though we have links to their original websites and web pages, you can also go to Facebook fan pages, which might be much more up to date.
Stratton, you pasted something into the comment thread that addresses part of this. Do you want to just hit a highlight on it and direct people towards it?
Yeah, I'll just encourage people to give that a read. Honestly, I'm still digesting it. Thank you, AIDS Institute, for getting me that data. But it basically shows some options for people who have recently become unemployed. That this is a shift in Florida policy to try to make it easier for people to maintain health insurance when they become unemployed. So some data drilled down there.
Yeah. As a reminder, if you're joining, we want you to be a part of this conversation. I see lots of amazing comments from folks like Michael Ruppel and Michael Rayner. Please throw a question at the panel if you'd like us to try and hit something, or if you want to help us distill that out and pull it out of the advocates we know are following along. Where to go, guys? Okay, here's an interesting one.
I know where you're going.
This one was very workshop. The question of sex in a COVID-19 environment and risk factors related to it. This is a really basic question that I think a lot of people have right now, and the answer is simple but also complicated. Is it okay to have sex right now in the middle of a global pandemic? How should our community be navigating that question?
I'll take I'm someone who's very sex positive, and I have written about my sexual experiences. And one of the things that started my real concern about COVID-19 about a month and a half ago happened during one of my sexual experiences with someone, right? I actually just stopped and said, wait a minute, should I be kissing this person? And my suggestion is not to have sex with anyone unless you have been together for over 14 days with no contact with anyone else, and you're not showing symptoms, right? Then that might be okay. Because, if you're at home, you're already sharing utensils, sharing a bed, you already are making that decision of exposure with your partners, right? If that person goes out and then they come back in, they might bring back the virus. And then if they get they contract it, they might get sick, and they might also, in turn, transmit it to you. So my suggestion right now is to not have sex, even though I miss it and I would love to right now. I'm really reframing myself because I still go out. I've been to the supermarket a couple of times. You know, I do have a brother, I have dogs. And so we are aware that our lives has to continue, they have to continue. So if you are really homebound with no other contact, you know, and I want to really step away a little bit from the script. And just 2 days ago, a friend of mine made me the story about a friend of his who is being older and locked up for over a month. And he contracted the virus through the delivery of food because there was no precautions taken when that food was coming in. So we hear a lot of stories. The idea right now is to protect yourself and protect your loved ones. One of the things that we have in our website is to remember the lessons that we learned from the HIV epidemic back in the 80s. The suggestions there is that you treat everybody as if they are living right now with COVID-19, like if they have contracted it. And you treat yourself as if you have as well, because we are unaware how many people are actually walking around with very mild symptoms or actually completely asymptomatic. So you might not be suffering from anything, but you might be exposing other people to COVID-19 because you might be a vector. You might be actually shedding virus without knowing that you have it. Look at Rand Paul, right? No symptom.
I mean, I think it's a very important point that this is one of the defense mechanisms that we have as a community have, that we've been through this for decades, and we've learned some really important lessons, regardless of how the government treats us, about how to take care of ourselves and stay healthy. And one of those most basic lessons was, as it pertained to HIV and now COVID, is to treat, as Alejandro said, everyone as though they have it. And don't do anything that you would be uncomfortable doing if you were absolutely certain that the person you were talking to or being with had COVID-19. And then the same thing for yourself, to act as though you have this. And don't ask somebody to take a risk with you that you would not ask them to take if you knew that you had COVID-19, if you knew you were a carrier of coronavirus. That's a way for us to take care of ourselves and others. And when it comes to sex, you know, it's really just basic common sense. There's some discussion about whether it's still not yet known whether coronavirus can be transmitted sexually. It seems as though it likely could, but it's almost irrelevant because sex is such a physically intimate act that you are breaking the most basic rule of stopping transmission, which is social distancing. At least
social distancing. Exactly.
I mean, phone sex, great. You know, internet sex, no problem. But if you're going to be in the room with each other, now is the time to take a break and be safe, unless your sex partner is someone who you are self-isolating with at home. In that instance, then if you're already sharing utensils and holding hands and being together, you've basically taken on those risk factors in the same way that we understand that longtime couples may make decisions about whether or not they're going to practice safe sex because they understand their risk factors as a couple.
I want to address two questions that we get from the comment section. And Jeremy is asking if someone believes that they have been exposed to HIV or they have contracted HIV during this time, if they can get actually HIV tested. In our, this is one of the questions that we address in our Q&A. And yes, a lot of organizations right now are offering services in a modified way. So they're making sure that we're still getting STI, PrEP, and testing services. So even though at the very beginning of the shutdown, we believe that some of these agencies did close for a couple of days, we have been restructuring and making sure that people do telehealth, that they call before showing up, right? That people are following social distance, that anybody who's getting tested will be screened prior to walking into a building, that they might check for symptoms or exposure prior to that. So organizations are taking not the brunt, but they're taking really good care of continuing to offer services because we are aware that people, lives continue. I was one of the people who went straight up to AHF, which, by the way, shout out to AHF. We are a beneficiary this year of the AIDS Walk, which unfortunately won't be happening live, but I think that we have a virtual event for the AIDS walk, and you guys can continue to actually donate to our team. Sorry, I know that this is a very delicate time, but I really want to shout out to AHF because I went to the wellness center prior to when things were starting to get a little crazy. You know, I might be one of those people considered to be a little panicky because I did live through the through the HIV pandemic, and I am someone who's living with HIV. So back in January 26th, I started to really taking precautions. I was in Tallahassee. I bought my mask, and people were kind of looking at me weird, right? Because I am one of those panicky people. But I have been able to really bring down my anxiety by really reading and finding out facts and data. We don't want to be listening right now to gossip, to rumors, to people who are, oh, I think this, I think that. This is the time. We do have time in our hands, right? So this is the time to sit down, read a little bit. We have put a great set of resources for you. You know, sometimes we wonder, where do I look for this? Where do I look for that? All the information is so scattered. We have spent a great deal amount of time compiling these resources for you so that you can find the answers to your questions in one space. So the short answer, Jeremy, yes, you can still get tested, and you should do so by calling your agency or your favorite provider to find out how you can make those arrangements.
And Joe,
so there were,
you saw. Go ahead.
I was just going to jump in to say we got lots of cosigns on the conversation around sex. David Fawcett says he agrees with Alejandro, best to have sex with yourself or virtually. Donna cosigns you, Stratton. And I just want to say out loud that the COVID-19 moment has created an environment where I'm on town hall meetings where my boss is talking about phone sex. So that's fun and interesting. We got some questions in the comments. Maybe this is where you were headed, Stratton, but I think let's jump to that. This one is super interesting and not one that we've talked about. Let's riff on it. Wyatt is asking, Wyatt says, I've seen themes emerge between COVID-19 and HIV criminalization. Many articles have come out concerning people being criminalized for spreading COVID-19 similar to HIV. I think you're right, Wyatt. We've seen that in a bunch of other countries so far. Do you think that the panic surrounding this pandemic will enhance the criminalization of infectious disease?
It is a real concern, right? So we can't really hide the truth. The truth is that we're concerned that it might happen, right?
Right.
Sutton, do you want to take it up?
Well, I think folks, I can tell we've got some real experts in the audience, but just for everyone, that we live in a world where there are laws criminalizing people with HIV in a very different way than others in this country that were really born out of the fear around HIV and AIDS in the 80s. And Florida is one of those states where, unfortunately, if you don't disclose your status, regardless of whether you practice safe sex and regardless of whether transmission occurs, it can be prosecuted as a third-degree felony, putting you at risk of decades in jail, which is ridiculous. And we have been working with a lot of the folks here to end that, and we've been making great progress. It's been amazing how we've moved the ball forward in Tallahassee on this topic. We came very close to a partial victory this year, and it really was an administrative breakdown that killed the bill. But we think that things are going really well, and I think this is a reasonable word of caution. Once again, here we are with tremendous fear, and when people are fearful, they don't make medically sound decisions. And will this add burden to our efforts to decriminalize HIV and instead, potentially lead to a backlash? I hope not. I do feel like what we have seen is that the science-based arguments really take hold across party lines on this issue. We've been really impressed with the wide bipartisanship of support for decriminalizing HIV. So, there are too many other dark places to go for me to go to that one right now, Wyatt. So I'm going to try to stay hopeful. I want to lift up Jenny Smith Camejo's question about home testing, because obviously that's a great alternative right now to having to leave the home and go somewhere for testing. And Michael Ruppel responds that home test kits are absolutely available and that they're working on a list of how to get them for no cost during the crisis. So that as we learn more about that, we will spotlight that in our resource kit for sure, because that seems like a really helpful thing.
we actually have an organization here in Broward called High Impacto, which is actually for focused on Spanish speakers and Latinx people, but they really offer services for everybody. And they do offer kits for testing at home, and they used to actually go to your place of work or your home and test you there in the privacy of your own home. So they are continuing to offer those services. A shout out to everybody, Emilio, who works at High Impacto. I want to take also a brief moment here to switch to Spanish. Para todas las personas que nos están escuchando que hablen español, estos recursos que estamos proveyendo Equality Florida están disponibles también en español en nuestra página. Si usted va a COVID-19, ahí va a encontrar los recursos que hemos compendiado para ustedes. También, no solamente, como dije, está en inglés, ahí mismo pueden encontrar un de estos que dice la versión, un enlace. La versión en español y todas las preguntas están contestadas en español. So, para todas las personas que hablan español en el estado de Florida, que somos muchos, la información también está disponible. Thank you.
Very nice, very nice. Well, a couple of shout outs. Ricky Junquiera, thank you for joining us. A leader here in the Miami market, both in the LGBT community and in the broader political community. Thanks for being here, Ricky. We've got lots of great folks joining. If you have questions, throw them into the chat, into the comment section. We are answering questions. Here's an interesting one that I know has come up for us, and it dips a little bit back into the policy space. So we are operating in an environment now, y'all, where cities and counties seem to have been the most responsive in the beginning of the proliferation of COVID around the country. The federal government has weighed in. We now have federal policy. But it feels like the policy environment is changing day by day. And so this question of, the question that we sort of teed up was, my city or county has enacted a stay-at-home directive. What does that mean for my HIV care? And I think where we are now, given that there's been really ping-pongy guidance from the governor's office yesterday, and then a change in that today, means that this climate around policy and where you live and which government is doing what has really shifted. So what do we think that this shifting policy landscape means in terms of access to HIV care? If you live in a community where you've gotten a pretty direct stay-at-home directive, what do we think people need to know right now?
Well, one of the things is that basic, very essential services are continuing. And the recommendation is that whenever you want to make a decision regarding your health or going anywhere, you should call your provider first. So we really have to make sure that you are not just leaving your house and putting yourself at risk of getting into trouble with the law. There's places where they have curfews. There's places where they have very strict, and up until this week, Florida was not one of those states, unfortunately, right? We just landed one of these stay-at-home orders. But in my experience, and I'm not sure if it's happening the same throughout the state, I see cars out all the time, which makes me wonder if all those people are looking for basic services. There's right now the idea that these places are doing telehealth and they're making considerations for a reason, and that's to keep you safe at home. And I want to also shout out to Jenny for her comment about comparisons and drawing parallels between HIV and COVID-19, because she is 100% right. We don't want to draw parallels between criminalization because they're completely different. HIV has been studied for the last 40 years, whereas COVID-19, not even 4 months, right? And Jenny also stresses a very important issue that we have talked about many times in our criminalization on HIV, is that we have a shared responsibility when you are taking the decision to have sex with somebody. It's not just one person, right? Sometimes it might happen due to sexual assault. We're not going to get into that. That's a whole nother video and a whole nother life. But yes, we don't want to draw those parallels. We've seen, like Joe said, videos of people in other countries being criminalized very harshly for being out. For example, right now, LA has an order that no one outside should not be wearing a mask. So we are not sure how that criminalization is going to happen. And that's why my response was very limited. It might happen. We don't want to draw those comparisons to HIV. Right now, the science tells us that someone living with HIV and who is on treatment will not transmit HIV to anyone sexually And right now we're also working hard to get organ donation into alignment with federal law. I know that we're living right now in a very uncertain time for any other health-related issues other than COVID-19. But the fact of the matter is that there's a lot of people who are still suffering from many other conditions who still need organs, and that has been legal federally since 2013 in Florida. We're still, almost 3 years from a decade not catching up.
Right. Well, so an important piece of that to distill is one theme of all of the directives that we've seen to date has been that there is room, whether it's a hardline stay-at-home order or a business closure or all of the gradients from what we've seen. A through line is if you are leaving your house to access essential healthcare, you're fine. And so I think that's a guardrail that people should all hold. If you are going to your doctor's office to get a prescription filled or to get treatment, you may need to be ready to defend that. You may need to just be ready that you have to tell somebody about that trip, but you should be fine in terms of accessing HIV care or any health care at all.
I want to jump in real quick, Joe. I also want to say that literally just today, the FDA lifted the ban of people, of men who have sex with men, of sex workers, and people who just recently were tattooed, for them to be able to donate blood. There has been a ban federally forever, and they just lifted it. Unfortunately, only for 3 months, but there is a huge shortage of blood. And so they're asking people who are healthy and who are part of the LGBTQ community who have not been able to donate before to do so because it's needed.
Absolutely, absolutely.
Clarification there, that 3 months means that if you have not had sex in the past 3 months, that you can donate. This is still a different standard than for other communities, but it's very different than the full year that was in place before. So now the new guideline is if you have not had sex in the past 3 months, you can donate blood.
Absolutely. So another quick shout out as we round the curve to the last quarter of our hour here. If you are joining us, you're joined by myself, Joe Saunders, Senior Political Director for Equality Florida, moderating with a panel of experts on staff at Equality Florida, Stratton Pollitter, our Deputy Director, and Alejandro Acosta, our HIV Program Coordinator and leader of the HIV Advocacy Project at Equality Florida. Throw questions you've got for us in the comments and we'll answer them. Y'all, guys, there has been quite a bit of discussion on the comment thread around a particularly at-risk community, both within the LGBTQ community and within the community of people living with HIV. And it's people who are in recovery or people who are struggling with addiction right now. And I wonder if we can spend some time on that. First question, I guess, just to get a kick started is, are there any services for people dealing with substance dependency available during the crisis? And I think the context of that question is, if you're in recovery right now, it's not always true, but it is possible, maybe likely, that you're part of a recovery program that meets in person, right? And it's pretty regimented. It could be as many as twice a week, 3 times a week, or it might just be your 1 a week meeting. But how is our social service infrastructure adapting in a post-COVID world?
Well, I really want to start with a disclaimer, right? That these are the times where sometimes drug use spikes because a lot of people are bored, people are anxious, people might be suffering from other mental health conditions that drive them to abuse drugs. So, drugs right now are anything from smoking, vaping, cannabis, cocaine, poppers. All those are related to your respiratory system. So as I said before, it's one of those times where we really want to make sure that we're sending the right message. We're not being judgmental here. We are aware that some people use drugs very responsibly, but it might be also a good time to stop. Now, for those people who are actually trying to stop and who are struggling, there's resources still in our website that will direct you to SAMHSA, and their website, they offer some guidance for people who are in recovery on how to deal with that. Now, different places might have different processes on how to continue with their recovery. one of the things that we might be experiencing in the future is also some drug shortages, right? Right now, there's a drug shortage of opioids and just in general, because the production of opioids in the past have gone a lot down because of the huge amount of people that have been addicted to them. But at this time, right now, was a decision made by politicians, but it's also a health decision. So that health decision is right now impacting health problems. So it's a very complex issue. We don't here pretend to have the answers for everything. I'm not a lawyer or a doctor. I'm just someone who reads a lot and is experienced in this. So if you can continue to have any questions, we're here to answer them. One of the questions that we think about a lot is stigma. And we haven't really addressed stigma. And I want to remind everybody that stigma is still ever present for HIV now more than ever. And that COVID-19 stigma is very much real. You have a president right now who has in the past referred to COVID-19 illness or the virus SARS-CoV-2 as a Chinese virus. And it's a very intentional way of putting the brunt of this outbreak on a single group of people and really putting those people in danger of suffering violence and suffering stigma-related issues. And when I say stigma again is everywhere. Right now, I'm someone who suffers from sinuses, and just being a little sniffly in the morning makes me wondering, oh my God, am I okay? I'm always checking my temperature. And just yesterday, as I was out buying fabric to create my little fabulous, cloth masks, a lady coughed in the line and someone just screamed at her. Like, lady, you need to be more careful. So there's a lot of, we're very on edge. One of the things that I want to, before we leave, to really stress, like I said before, even someone like myself who stresses a lot, you need to be able to trust yourself and your knowledge. So look for education. And let me also be very honest and clear, not all the answers are offered by the government. So you make sure that you're looking for the right resources and that you're reading and that you are educating yourself, if not now, when. And I've always said there's a lot of people out there who are unaware of their status. You need to know it. You need to know if you have syphilis. You need to know if you have chlamydia or gonorrhea, because these things might turn into an underlying condition. So you need to be on top of your health right now, whoever you are, regardless of your HIV status.
Joe, I want to lift up, we've got such expertise in the chat right now, great answers regarding people who are in recovery, getting resources and what's available online. We're so grateful for the expertise there. We're trying to gather so much information around HIV and around other vulnerable populations that we serve, LGBTQ youth, trans folks, but it's this issue of people who need mental health services not having access to in-person counseling and support cuts across that spectrum. And I fear that it is one of the big danger waves that is coming. I know on a statewide Safe Schools call today, we were hearing anecdotally that young people who are trapped at home with parents who are either unsupportive or maybe don't even know that they are LGBTQ, just how cut off they feel. And even things like Zoom, where you think, okay, well, at least they can talk to folks on Zoom, but they can't, because they can't talk at all out loud, or their parents will hear them and they'll out themselves, And so these are the kinds of concerns that we're trying to have a real sense of how big they are and how we help. So please don't end your input with the chat in the end of this call. Please keep pouring those resources in our direction. We'll do our best to broadcast them, because they're a huge help. I want to, around the stigma thing too, I just want to take a minute to go back to this point, because even as we are telling people, be careful, be careful, be careful, be extra careful right now, we also want to hammer home that HIV status alone does not put you at increased risk for coronavirus. And that while we know that we don't have confidence that medical providers understand and that we are fearful of the stigma that people might experience because folks don't understand the science. I'll give you an example from my life. My husband and I were on the phone this week with doing some telemedicine with our doctor to get some prescriptions refilled. This has been our doctor for a decade. She works at Mount Sinai on South Beach. We're talking to somebody who's very familiar with the LGBT community. And 3 times on the call before I stopped her, I don't know why it took me 3 times, she said, you guys have to be extra, extra careful because, Christopher, because of his HIV status, is at a much higher risk for complications. And finally, I just said, know that you really have to not say that. It's not true. He has an undetectable viral load. He's been in treatment and has responded well to treatment, and he really doesn't have any additional risk factors. And I just thought, wow, if she thinks this, if we wind up in a situation where Christopher had to go to the hospital, and I wouldn't be there with him to explain this to someone, how do we make sure that our community is being treated just the same way that everyone else is? That is a problem we are afraid of, and we are doing everything we can to stop it. And while we don't want to unnecessarily raise people's fear and anxiety, the reality is if that starts happening, it's going to start happening fast, and we want to know about it. We've been in touch with Jared Moskowitz with the governor's office, and the Michael Branner can give me his exact title, but we've been told if you see this happening anywhere, let him know, and they'll be in touch with that healthcare system immediately. So do keep an eye out for that, but it is real, and we're working on resources to keep blasting that information out, that HIV status alone does not make you more vulnerable to coronavirus.
I want to elevate something that Jenny Camejo from Positive Women's Network brought to the comment section, and that is that there is a lot of people right now, children included, partners who are experiencing abuse. And during these moments of quarantine, there is nowhere that you can go. So to those people who might be experiencing violence, the police are still working, right? They might be busy doing other things, but and I know that this might sound horrible because some people don't have other options. If you think that your safety is in immediate danger, you still need to contact police, right? So if you can, that's just trying to elevate that. And for children who are also suffering like Stratton says, from even lack of privacy, we sometimes forget that first of all, none of us have ever experienced anything related to this type of emergency, and that we do have children, LGBTQ children, who are going to be suffering mental health issues for a long time because of this. It's a very unusual place. I don't want to sound negative, but on the contrary, it is again the time to be loving. It is the time to look out for each other. Just because we're social distancing doesn't mean that we have to be distant from each other. And this is a great opportunity to use that space time, to use Zoom, to call that person that you've been thinking about for a while and you haven't. It is a moment to also reflect on how we can continue experiencing great relationships through time and space. So again, a reminder of we right now are all in this together. Rich people, poor people, sex workers, non-sex workers, nuns, we're all in the same boat. And it is a great, again, reminder to people to really think about that stigma, because stigma right now is pointless because it could be you tomorrow. It could be the president tomorrow. Hopefully not.
Right.
So,
well, let's do this, guys, because we're coming in for a landing. We're committed to keep this conversation going after our town hall ends at 6 o'clock. But I think it makes sense to phase into some closing thoughts and statements. But first, for those of you who are participating, I just want to lift up again that a lot of the data that's being discussed here is available on the Equality Florida website, eqfl.org, under our COVID-19 resource guide. That is an organic document that is going to be informed by this conversation and some of the resources that have been shared in the comment section. So we really want to lift this up for our LGBTQ and HIV community as a place to go to get real, filtered, trusted information in a very fast-paced and changing environment. Second, I want to remind you all that all of this really is possible because people like you step up to support our work. And I can tell you there's some folks who are living in kind of a sort of frozen spot around COVID. That is not the experience of your Equality Florida team. We might be the busiest we've been all year, and that's including after a very crazy legislative session. We are in it. We are identifying the gaps and filling them. And if you see that and want to keep the gas in the tank, you can support us with a donation today that will be matched by AIDS Healthcare Foundation dollar for dollar. And I know that our production team is going to post that link in the comment section as well. If you can make a gift today to support our work, we would value that. Let's face the closing, guys. Stratton, I guess the tee up for this is a place to elevate the top lines, the things we think are most important. And Stratton, I know I'm going to throw it to you first. You've spent a lot of time. I feel like you're one of the clearest voices right now in the state that is raising this question about the threat of medical rationing, this moment that could come, this intersection between stigma related to HIV and this thing that is not happening yet, and if it does, will happen right away. Like, what is the path forward on that, knowing that we don't have all the answers, and what do you think are the most important things for people to be thinking about and knowing right now? And the same question to Alejandro, but in a different context. What is the most important thing for people to take away as we phase into the close of our town hall?
Yeah, coming into this, what we were hoping to give people is information to take care of themselves right now. As a community, we've learned really important lessons about how to take care of ourselves and how to take care of our own, even as we are generous with the world. And so we wanted people to have the information they need to understand what their risk factors are around coronavirus. And, it is important to know that, yes, while HIV status alone does not make you more vulnerable to coronavirus, if you are not in treatment, then you very well may be severely more vulnerable. And so we really want to push people to get into treatment. But we also want to equip people with this issue that you're bringing up, Joe, which is that we want people to have the data, the information, the resources that if they do experience stigma in the healthcare system, and this goes beyond just HIV status. We're worried about how trans people are going to be treated and gender non-binary people are going to be treated in a moment where hospitals are under enormous strain and medical care is being rationed. So we want to give people the science in a way they can carry it into those offices in their hands and advocate for themselves, even as we do everything we can to lift this up and speak to our healthcare systems and to our government officials. We've talked to the Agricultural Commissioner's Office about putting out a statement on this as well. So we'll keep doing that. You all keep telling us what you're hearing. Experts on the phone, I know that you're having these conversations nationally, and there's so much information we're all trying to sift through right now, on all these different fronts. So anything you see that you need to lift up to us really helps us speed our way towards getting people information and resources to take care of themselves.
As someone living with HIV and as an ex-educator, I want to really quote Michael Rupel, who earlier this week during AIDS Watch 2020 said that the lack of knowledge creates trauma and creates that was the worst part of it all. I had the quote all ready to go and I messed it up. So Michael Rupel, a lack of knowledge creates fear and trauma. Thank you again, Michael Rupel, for that quote. I really want to leave with that. It is a time to really take care of yourselves, to read, and to not be led by fear, to be led by data and by facts.
Absolutely. Absolutely. Well, this is the beginning of the conversation. Thank you again to Alejandro Acosta, our HIV program coordinator and the leader of the Equality Florida HIV Advocacy Project, Equality Florida co-founder and Deputy Director Stratton Politzer. I'm Joe Saunders, your Senior Political Director. There are lots of great comments. We're going to sift through all of that, make sure we grab everything for our resource guide, and stay tuned for more programming as we help people in vulnerable communities navigate this crisis. Thank you all so much.
You want to just give a quick plug to next week's town hall for anyone who enjoyed this conversation? Next week will be same time, same place, talking about the legislative session. So we'll get deeper into the decriminalization conversation as well as some other exciting twists and turns there.
Indeed, lots of digital programming in a COVID-19 world. Thank you, everybody, for joining. Thanks for the plug, Stratton, and see you next Thursday.